I hope that they continue from strength to strength, and let me take this opportunity to congratulate as well their caretakers and the people who obviously take care of them and ensure that they are comfortable and that in the winter of their years they are indeed having a good quality of life. From that note of celebration, I move to a note of sadness. We have learned of the passing of Dr. McGeed, Dr. Adley McGeed. Dr. McGeed is someone who is well known to us, and of course he was the founder of the Mount Nevis Hotel. The entire Nevisian community has therefore learnt of his passing with great sadness. He was dearly loved and respected in the wider Nevisian community, but more specifically in the Nevis tourism industry. Dr. Adley Abdel McGeed was the founder, owner, and chairman of the Mount Nevis Hotel. He was known as a kind, fatherly, and understanding individual, and although he was not a Nevisian by birth, he certainly was one at heart. He was adored by visitors and locals alike for his rapport, engaging spirit, and the personal attention he gave to guests. This tourism pioneer established the Mount Nevis Hotel in 1989, the first pizzeria on the island of Nevis, and the 100-seat Oral Brandy Conference Center. Dr. McGeed was 92 years old at the time of his passing on June 19th. I take this opportunity to extend from this rostrum my deepest condolences to his family and to thank Dr. McGeed for his tremendous contribution to the people of Nevis and to the tourism industry more specifically. He was certainly a pioneer who contributed much, and may his soul rest in eternal peace. Let me move, ladies and gentlemen, very quickly to speak to the issue of our vaccination effort on Nevis. As you are all aware, the country is under a current state of emergency. Only yesterday in the National Parliament, that state of emergency was extended for a period of 6 months, and certain restrictions in the context of that state of emergency are currently in place. On the island of Nevis, we have, for example, a curfew that from 5 a.m. to 6 p.m. you can be out and about, but from 6 p.m. until 5 a.m. the next day, you are expected to be confined to your yard, your space, your home, unless there is some sort of emergency or unless you have an exemption under the relevant statutory rules and orders as an essential worker. We have also sought to restrict movement of persons between St. Kitts and Nevis. Why? Because the island of St. Kitts has seen an unprecedented outbreak of the coronavirus, and it is now clear from the reports from our Chief Medical Officer that some new strain called Lambda has found its way into the Federation. It is said that that new strain is quite contagious. It is one that is easily transmitted, and as a consequence, we feel that there was a need to take some greater restrictions. And as a consequence of that, NASPA, or Nevis ANC Ports Authority, which controls the port on Nevis, both the port in Charlestown and the water taxi pier at Wally, has announced that all service from the port in Charlestown has been suspended for the next 2 weeks, and that those wishing to travel for emergencies, medical emergencies, or who have been able to procure a pass from the Commissioner of Police, that they can travel via the water taxi pier. I would wish to apologize to the general public for the inconvenience that is being caused, but we are dealing with a matter of life and death, and I wish our people to understand that it cannot be business as usual, that during this unprecedented time in our history, all of us, and I emphasize all of us, have to share in the sacrifice. I recognize that some people are accustomed to seeing loved ones across the waters in St. Kitts. Some are accustomed to going over to Lyme and to hang out, and vice versa. We are one people, one family, and we understand that people are accustomed to moving freely. We have been forced to curtail and restrict that movement in an effort to control this coronavirus. It is a matter, I think, of some note that for the 14 months prior to May 19th of this year, the entire nation only had 45 cases of COVID, all of whom recovered. Since May 19th, in the just over 1 month period since then, we have had over 400 additional cases of COVID-19. Of those, one has been on the island of Nevis, and the others have been on the island of St. Kitts. And therefore, following the science and the data, we have responded accordingly, as we think any responsible government would have to respond. And so that is the current state of play. I recognize there's a lot of chatter, there's a lot of conversation, and that is to be expected in a robust democracy such as ours. But at the end of the day, our focus is on preserving life and seeking to protect the lives of our people. We had no deaths in our federation. And since this outbreak of May 19th, that began on May 19th of this year, we have now recorded 3 deaths in St. Kitts. I would again use this rostrum to express my deepest condolences to those families who have lost loved ones, and to those who are suffering currently, who are affected and afflicted by this COVID-19 pandemic. I would express deepest condolences to you and wish for you a speedy recovery. Brothers and sisters, we have to take this seriously. Some have said to me that they're tired of hearing me talk about COVID, but it is part of leadership and part of the responsibility of leadership for us to speak to these matters that impact us. COVID presents an existential threat to our island of Nevis and our wider federation of St. Kitts and Nevis. And we must therefore deploy every weapon that we have against it. We have, of course, the non-pharmaceutical measures, the wearing of masks, the social and physical distancing, the curfews and lockdowns, the washing of hands and sanitizing of hands, the coughing into one's elbow, sneezing into one's elbow, trying as much as we can to prevent the transmission of this disease. We know that it is highly contagious, and now with this Lambda variant, even more so. We also now have a pharmaceutical measure, which is the vaccine. And we have been pleading, begging, and beseeching our people to get vaccinated so that they can have the best chance. Some have said the vaccine doesn't prevent you from getting COVID. And while that is true, it is also true that the vaccine reduces significantly your risk of getting COVID. Indeed, the numbers suggest that with the second dose of the Oxford AstraZeneca vaccine, you have somewhere in the region of 90% or thereabouts protection from getting COVID. The evidence also suggests that if you are vaccinated, the ability to transmit COVID to others is also dramatically reduced. The evidence further suggests that if you're vaccinated, the chances of you getting very sick or dying is also dramatically reduced, almost to zero. Indeed, some who have died, who have been vaccinated, the science will show, had serious underlying conditions as well, what they refer to as comorbidities. And so COVID, being the intelligent killer that it is, seeks to attack persons who are already compromised in terms of their health. And I would want each of us to reflect that while you or I may think that we are healthy, we may have in our household elderly parents and grandparents who have underlying issues that make them not as healthy as we are. We have children, particularly the young, who are outside the immunization group and therefore remain vulnerable. We have our children in our schools who are outside the immunization group and therefore vulnerable. Imagine, if you will, that through your own position of not being willing to vaccinate, you were to take home the virus to granny, or to mommy, or to daddy, or to your child, little Johnny or little Mary. Imagine that for a moment. And that is why I keep saying that this is not only about us. It is not only about your individual rights, as people tend to trumpet. It is also about your family, your family members. It's about your community, and it's about your island. It's about those you work with, those who are in the same space as you are each day. And so sometimes I would want our people to think not only of themselves, but also of those around them. We are advised that one case on St. Kitts that got out into the community. And here we are at a point in time when we all thought and expected that the country would be reopening, that we had the very best record, not just in the region, but in the world in relation to COVID. One case getting out into the community, and here we are, over 400 positive cases in 1 month, compared to 45 cases in the previous 14 months. If we require any further evidence of the dangers and the risks that we face, then I do not know where that evidence should come from. It is, as they say, clear as day that this is a clear and present danger that we all must confront together. In terms of our vaccination effort here in Nevis, we have now opened all of the clinics except Combermere to vaccinations every day. And so for those of you here, members of the press who are not yet vaccinated, as soon as we are done, you can go to any of the clinics and get vaccinated. For those who are listening, members of the public service, members of our statutory corporations, members of the private sector, for those who might be at home listening, you can go today, you can go tomorrow, you can go any day, every day to get vaccinated, because we have opened all of the centers in Nevis and made them vaccination centers. We are making every effort to ensure that our people get vaccinated, because the science tells us that vaccination is our best shot. It's our best safeguard. It's our best weapon against COVID-19. Thus far, I'm pleased to say that some 5,166 people here on the island of Nevis have taken a first jab. Some 5,166 individuals, just like you and I, have taken up themselves out of their homes and gone to the clinics and got vaccinated. Of those, some 3,893 persons, as of yesterday, have had their second dose. Currently, as I speak to you, our target population, that is the adult population, based on the last census figures, is at 8,594. That is not the general population, let me be clear. That is the target population, the adult population, as we say. But that excludes those who are under 18, and we have been excluding as well, I believe, those who are over 85. So 8,594. That's where we hope to get. We are at this point at 5,166, or 60.1% of that target have taken a first dose. 45% of that target are now fully vaccinated on Nevis. And if we were to widen that to look at the general population, which stands as at the last census at 12,277 persons, it means that we have 32% of our general population in Nevis that is now fully vaccinated. You will see that at 60.1% of our target population having had their first shot, that we are lagging behind our sister St. Kitts. And I would want to use this opportunity again to say to my brothers and sisters in Nevis, do not take COVID for granted. Do not take COVID for granted. We have seen what it has done elsewhere. We have seen even now what it is doing on St. Kitts. Do not take COVID for granted. Too many of us are sitting back as if Jehovah God has blessed us so abundantly on Nevis that we cannot get COVID and we cannot get any outbreak on Nevis. I hear the constant refrain, no COVID in Nevis. No COVID in Nevis. But imagine, my friends, how easily that can change. Prior to May 19th, we were saying the same thing. No COVID in St. Kitts Nevis. Free up the place, open up, no COVID. 1 month, and over 400 cases. Who's saying that now? I am not a foreteller of doom and gloom. Let me use my favorite word. I'm not a soothsayer. I know not where we will end up or how tomorrow is going to pan out. I do know that the people who do best in life are those who prepare. We do not hear that a hurricane is coming off the coast of Africa and we sit back. We start to pay attention. We go and we stock up with food. We get our shutters put on. That is how you prepare. Even the Bible talks about being prepared. And we do not know, and I am not here as a predictor to say to you what will happen tomorrow or next week or the week after. What I can tell you is that currently, as of today, Nevis has no cases of COVID. The one case, which was number 15 in Nevis, I'm pleased to report, has recovered fully. All the contacts of that one case, and there were several, who were traced and tested, have also now all tested negative. And just so you understand the process, when contacts are traced, they're tested initially, and then they're tested again 14 days later, just to make sure that in the interval they would not have developed COVID. And so I was very pleased yesterday to learn that all contacts from case 15 that were tested initially and were all negative have also now on their second test all also tested negative. That is good news. I gather that since the outbreak on our sister St. Kitts on May 19th, we have on Nevis tested over 600 persons. It is a remarkable thing that with an outbreak on St. Kitts 2 miles away, and with the traffic that we know has always existed between the islands, that of the over 600 tested in the past month, we've had only one positive on Nevis. And I am pleased and grateful to God that that one positive, as I said, is now fully recovered. He was never sick, and he's now fully recovered. And for that, we are truly grateful. But I point out the numbers only to point out to you how easily it could have been different. How very easily it could have been different. This case number 15 had considerable contacts in the community. Partners that he was liming with, people that he visited, considerable contacts. And I want you, the members of the press and the members of the public, to consider for a moment what it would have looked like if those contacts, or even a small percentage of those contacts themselves, tested positive. Because each of those contacts would have limed and then went home to their homes with their mother and father and younger brother and sister. Each of those, in fact, some of them had to be taken off their jobs right here in the public service and asked to go home because they had come to work not knowing that they had been exposed. What if any of those had tested positive? And that is why I keep saying to Nevisians, do not take this for granted, nor look across at St. Kitts and feel that we're somehow better than, we are luckier than, we are smarter than. Let us look at this and say, but for the grace of God, there goeth Nevis also. And do not use this opportunity of calm to look over and beat our chests and think that somehow we're doing something so great, but rather to use it to prepare ourselves. Go out and get vaccinated. Ensure that when COVID comes, and it will come, that we have the best weapon available to us to fight it. I am speaking in this way because this matters, and it should matter to all of us. As Premier of Nevis, I have met with the churches on this matter of vaccination. I have met with the hotel industry. I have met with the taxi operators and tour operators. I have met with the teachers, a large fraternity in the community. I have met with the non-teaching staff at the schools, another large fraternity. I have met with the High Command of the police. I have met with Dr. Janice Hodge and the Honorable Cleone Stapleton Simmons as representatives of the NRP. I have met with all who is prepared to meet, and the message has been the same. We need all hands on deck. We need cooperation. We need partnership. We need to be together on this. Because when COVID comes and knocks on the door, it doesn't ask if you're NRP or CCM. It doesn't ask if you're male or female. It doesn't ask if you're rich or poor. COVID comes and the evidence is there to show that it comes to kill. It comes to hospitalize. It comes to destroy lives and destroy livelihoods. And our people need, I believe, to wake up to that reality. And not to continue with our heads stuck in the sand as if we are immune to COVID. And that Nevis is so blessed that we will never get it here. No. I think if I'm allowed, I hope my friends in the clergy do not be upset with me, but I believe if I'm allowed, I would say that God is sending us a very clear message. God is giving us an opportunity to prepare ourselves, and it is for us to decide. I do not want for us to be in that position where we say, woe, woe is me, woe is me. Woe unto me and my family because we did not listen. I have used every opportunity, and every member of my cabinet has used every opportunity to be consistent in our messaging, that the vaccine provides us the best defense, the best shot, the best weapon against COVID-19. It is available at all of our health centers, and all of our health centers are open all day from now until the end of the month. Please go out and get vaccinated today. Let me switch gears and indicate that on the continuing fight against crime, and even though crime has not been topical, we continue to equip ourselves and to prepare, understanding that crime is a social phenomenon and can happen at any time, despite best efforts. And so our CCTV commitment, we continue with that. On the last occasion, I had spoken about technicians coming in from overseas. I'm pleased to say that the engineers from Mexico would have come to Nevis on June 26th. They worked in a bubble. They departed on the 9th of July. And while on island, that technician installed a video wall, monitors, computers, access control at our CCTV command center. We had a snag in terms of equipment where the incorrect cabling was sent, but I'm advised that that cabling should be here shortly. And once that is installed, then the center will be fully operationalized. Staff members, you will see them all across the island, are continuing to run the CCTV, and indeed, they continue to put up the cameras around the island. And I would just like to say, which I think is a matter of some interest, that we are not just doing a basic CCTV system. I'm advised that the system will have capacities, for example, like license plate recognition. And so it will be very important that that information is immediately available to our law enforcement so that we know exactly who is moving and for what purpose. And so that is going to be critical. And this is technology which has been deployed elsewhere around the world. I comment all the time to many who say that they're concerned about privacy And yes, while those are concerns, I say all the time that if you go to a city like London, which is one of the most surveilled cities in the world, at every street corner, you see the signs saying CCTV coverage. And that London, that England, that bastion, they say, of law and order, that is what applies there. And so I think that this is one of the tools that we promised and that we are rolling out. Let me move very quickly to the Ministry of Health. This, to me, was very big news when it happened since the last press conference. It happened on June 11th, Friday, that we received $100,000 US worth of equipment at the Alexandra Hospital for our pediatric and maternity ward. The donors were Mr. and Mrs. Bruno Moniville of Switzerland. The donated equipment includes emergency crash cart, infant incubator, skin temperature probes, an electric maternity delivery bed, fetal maternal monitors with carts and printer paper rolls, jaundice meter, resuscitation unit. The Moniville family has been visiting Nevis for some time, and as a result of our hospitality, has decided to give back to the people of Nevis. We would wish to publicly again express gratitude to Mr. and Mrs. Moniville for this very generous donation towards the healthcare on Nevis. Let me also express gratitude to Adrian Daniel of the law firm of Daniel Brantley, because it was through his intervention and his pushing on this that this donation became possible. And so, Mr. Daniel, if you're listening, thank you for your contribution to our hospital, and thank you for your effort on behalf of the people of Nevis. We would want, ladies and gentlemen, to express thanks to Nurse Jeffers and her staff of the community health centers. But not only to them, but to those retired nurses who have returned to assist in our vaccination drive. The health centers have been open on the weekends, including Sundays, to accommodate persons who wish to be vaccinated. And we are thanking those nurses who gave of their time to make this service available. We, of course, as I just ended by saying, continue to encourage persons to get vaccinated as we fight against COVID. Now, due to the outbreak that is currently being experienced on our sister island of St. Kitts, we have implemented some new measures at the Alexandra Hospital. The Alexandra Hospital here in Nevis, regarding persons with respiratory illnesses, if you're experiencing a fever, cough, shortness of breath, or other respiratory symptoms, you are to remain where you are and call the respiratory checkpoint at 665-5473. 665-5473. That's the respiratory checkpoint. And that is if you're experiencing fever, cough, shortness of breath, or other respiratory symptoms. Do not go to the hospital. Call 665-5473. Your information will be taken on the phone, and you'll be given the necessary instructions. Persons who have life-threatening emergencies and need the ambulance should call 469-3333. Recall that the 469-3333 number was a new initiative that we put in place to better serve those having emergency needs and requiring the ambulance. So everybody out there, I want you to write down this number, 469-3333. That is the dedicated ambulance service. And as you know, through the efforts of our Minister of Health, the Honorable Hazel Brandy Williams, we were able to secure 2 brand new ambulances just in the recent past. And so we are equipped, and we have put a number in place so that you can call and get ambulance service for life-threatening emergencies. They have given me a list here of some life-threatening emergencies: loss of consciousness, acute confused state, prolonged seizures, severe chest pain, difficulty breathing, severe bleeding, severe allergic reactions, burns, stroke, heart attack, or any major trauma. The following hospital procedures, please take note, are suspended until further notice. No outpatient clinics, no physiotherapy, no routine lab services, no routine X-ray and ultrasound, no elective surgical procedures, and no visiting. We recognize again that these decisions and these measures will cause some difficulty for some of us. But we are hopeful that you will bear with us. These measures are for your safety and well-being and have been put in place as a direct result of what has been happening on St. Kitts. If I can move just very quickly to speak to the Pinnis Park, it is progressing smoothly. It is currently on target for scheduled opening, and we will open it in December of this year. Construction is now 70% complete. The landscaping is at 43% complete. The most recent work was the casting of the roof of the visitor center, and significant progress has been made on the construction of boardwalks, the outdoor bathroom facilities, installation of outdoor lighting fixtures and finishes to the amphitheater. Upon completion, the park will feature a smoothie shop and a game room. Persons are reminded to apply for the position of manager of that park. The deadline is Wednesday, 30th June 2021. Details of the qualifications and requirements can be found on the Ministry of Tourism's Facebook page, and persons are asked to email their CV to john.hanley@niagov.com. John, John, dot Hanley, Hanley, @niagov.com, or call 667-1180 for further details. Let me switch very quickly now to Public Works. Public Works has, in my humble estimation, been doing quietly some phenomenal work here on the island of Nevis. I start by commending Minister Spencer Brand and his entire team at Public Works. Noteworthy since the last press conference is that the Cherry Gardens Soakaway remediation project has not only been undertaken but completed. The project commenced on May 25th and was completed on the 16th of June. Mr. Alistair Thompson served as a project manager on this project, and I commend him. He did an incredible job. Other members of the Public Works team, namely Mr. Vincent Carey, Lester Liebert, Troy Nisbet, Marvin Hamilton, Siobhan Claxton, Keithley Bailey, and Kelvin Wilkin, all contributed yeoman's effort to bringing this project to a successful conclusion. In the end, members of the press, a total of 30 residential properties in Cherry Gardens received new soakaways. 30. The project was budgeted to cost $280,000, but was completed at a cost of $277,470.85. So the project came in about $2,500 short of what it was budgeted to cost. So I think that we did well in the circumstances, and we were able to bring relief to 30 residents, 30 homes in the Cherry Gardens neighborhood. Just to remind members of the public that this has been a long-standing issue, where homes were built in Cherry Gardens, but the soakaways and the sewage systems were inadequate. And as a consequence, many who traversed those roads saw that people were forced to run water into the streets, and some of their yards would overflow because they had nowhere to put particularly their gray water. And so we intervened. We sent in the engineers to do an assessment, and having done that assessment, some 30 homeowners are now much better off, and the health risks that we hitherto had over there have been eliminated. And I thank those, particularly Mr. Thompson, who led this commendable effort and took it to completion in less than a month. From May 25th, 2021, they were done by the 16th of June. I have heard from many of the community of Cherry Gardens who have expressed how happy they are that finally this problem that they purchased, I say they purchased the problem because obviously when they bought the homes they didn't know. So they purchased the problem, and that the government, notwithstanding the lapse of time, has now fixed the problem. Let me commend Minister Brand again, but also let me commend the Deputy Premier and the leader of the Nevis Housing and Land Development Corporation, the Honorable Alexis Jeffers, for their efforts, and the entire cabinet for supporting this initiative to bring relief to the people of Cherry Gardens. Now let me say a word, because this is Nevis. All kinds of individuals have now been calling saying they need their soakaway fixed too. So people have been calling from all across Nevis. Say, I hear you all fixing people's soakaway, and I have one here need fixing. I just want people to understand that this was a specific project, specifically for the people of Cherry Gardens, because we recognize that they had an issue that was not of their making. Those homes were built in a defective way, and as a consequence, they had this problem. So we had an obligation to fix the problem. This is different to those whose septics have filled up over the years, for example. And so I just want people to understand that this was a very specific program done to benefit the people of Cherry Gardens. The Butler's Road Rehabilitation and Reconstruction project commenced on the 26th of May. This began with clearing, grubbing, and excavation works for road widening. The first segment of earthworks has occurred along Cistern Path, and they're currently out there putting up retaining walls. So we are working on that to get that done. The Public Works Department has also commenced our road milling and resurfacing program for roads in and around Charlestown. On Sunday, the 6th of June, they would have done Market Street. On Sunday, June 13th, they did Happy Hill. On Sunday, June 20th, the main street from the bus stop at Memorial Square to Government Road was milled and resurfaced. And we're doing small portions, but frankly, you will see the difference and feel the difference when you drive on it, and we tend to be doing it on Sundays when it's least disruptive. We have contracted 2 contractors to undertake drainage upgrade projects along 2 watercourses. The first is at Craddock Road, where they're going to do a culvert there at the Newcut Road area. This includes clearing the sides of the gut, constructing a 300-foot concrete U-drain along the gut. The concrete block U-drain in Craddock Road has been completed, and the rock work is approximately 50 feet east of the culvert is ongoing. Then we're doing a U-drain in the watercourse in Ramsbury, just north of the Shiloh Baptist Church. That is ongoing. The concrete block U-drain is 400 feet in length. Both of these areas have experienced stagnant water from rain runoff as gray wastewater from adjacent households, and all of this pose health hazards such as unhealthy odors and mosquito breeding. We have had a lot of complaints, and again, through Minister Brand's insistence, we are now making a difference in Craddock Road and Ramsbury for the benefit of persons there. The project management unit, which is government has put together, has been working very hard. I want to commend them because they are now working on the perimeter fencing and lighting for the Hamilton Reservoir. They have prepared and are administering works contract for the installation of the perimeter fence. They're likely to use 2 contractors up there. They also sent out and received bids, labor-only contract for the installation of a metal roof on the reservoir. That reservoir was built in 1904. And so we decided not to knock it down, but rather to put a new roof on it. So we are preparing contracts there as well and inviting bids. The Cotton Ground play field, I think this will be of value to the people of Cotton Ground. And I'd want to publicly commend my advisor, LaToya Jones, who insisted that this was one of the priority projects in St. Thomas's. This Cotton Ground play field, as you know, has had a very dangerous situation where the wall has been falling over now for many years. And we have gone there and looked at it. The engineers have had a look, and we have prepared a request for proposals. We are soliciting now from 2 engineering consulting firms a design for that perimeter wall to remedy that problem once and for all and to remove that serious risk of grievous bodily harm to the people who traverse that area. Offers are being evaluated, and we expect that by the end of June, 30th of June, we should have the reports and therefore be in a position to move that significant project forward. So I want the people of Cotton Ground to know that they too are part of what Public Works is engaged in. Switching quickly to education. The Department of Education will be holding its annual Prospective Teachers course from July 19th to 30th, 2021. Application for the course actually closed on June 18th. but they will be extending special consideration to the Nevis sixth form students who are currently writing their KEEP exams. Those who are writing exams, there's an extensive list of requirements, and please, if you are in any doubt, you can call the Ministry of Education to know what these requirements are. Incidentally, for those who are attending CFBC, you were able to negotiate with the federal government to ensure that those Nevisian students can do their exams in Nevis. And so they do not have to travel over to St. Kitts to do those exams for those who are enrolled at the CFBC. Culturama and the staging of Culturama 47. Culturama is moving ahead. It will be celebrated over the period Thursday, July 29th to Tuesday, August 3rd, but it will be scaled down even more than what it was prior. The Minister and those in charge of culture, the Honorable Eric Evelyn, will in short order address you in detail as to what you can look forward to for the scaled down edition of Culturama 47. Scaled down, as we know, because of the COVID-19 situation. Let me just now look at one indicator of what we are seeing on the island. You would have recalled, members of the press and members of the public, that this government implemented a number of measures as we sought to jumpstart the economy, to restart the economy that had gone quite dormant after, of course, our major engine, which was tourism, was taken offline due to COVID. One of the things that we did was we introduced a waiver of the alien landholding license fee, but only for existing homes. So if you wanted to just buy vacant land, you did not get the waiver. The idea was that the realtors, whom I also had met with, had indicated that they had a huge stock of homes, villas, that they were trying to sell but couldn't get sold. And as you know, the alien landholding license fee is 10%. And so immediately, if you were buying as a non-national, you had to pay an additional 10% to acquire that home. And so we thought about it long and hard, and we granted a waiver of the 10% as a part of our stimulus to try and get things moving. I'm very pleased to announce that that initiative, managed through the Honorable Alexis Jeffers as Deputy Premier and Minister of Lands, and instituted on the 1st of September 2020, that from then until now, June 25th, that 9-month period, by my tally, that we have been able to approve property on Nevis, change in hands, to the value of $70,639,880.33. So that's how much the value of property that has been moved under that particular provision stands in 9 months. I believe you'd agree with me that to move $70 million worth of property in 9 months is certainly significant. We have, from those completed thus far, during the same period, collected just under $2.7 million in transfer tax. Remember, I said we would have waived the alien landholding license fee. Again, for members of the public and the press, normally on a real estate transaction, if you're non-national, you pay 10% alien landholding license fee, and then everybody pays 10% transfer tax, whether you're alien or not. And so from those transactions thus far, we have collected $2.7 million in stamp duty, transfer tax. Clearly, on a value of $70 million, we would expect to collect just over $7 million over that 9-month period, but we understand that processing takes time. And so as of today, we have collected $2.7 million thus far. I say that because I think it is an indication of thoughtful policy making that is bearing some fruit. And for an island this size to move $70 million worth of property in 9 months, I think is very significant. Let me also add that in 2014, so I'm going back some time, we had introduced a fee to process alien landholding license applications. Hitherto, they were free to process. And we introduced a fee which says it's 500 EC dollars if you want to be a director or shareholder of a company, 1,000 EC dollars if you're applying to own a property on the island. And from 2014 to now, we have collected some $759,627 from that fee. Of note is that since the advent of COVID in 2020, we collected $150,500 in 2020 from that fee. But for the 6 months thus far of 2021, we are already seeing some $143,000 collected. So again, that is in conjunction with the waiver of the alien landholding license fee of 10%. This is now a processing fee. But we see that for the 6 months this year thus far, we have already collected $143,000 compared to $150,000 collected for the entire 2020. And then as we went back, we went as low as $62,000 collected in 2017. So we are again seeing considerable signs of life in the real estate market, and I'm hopeful that the realtors out there who are enjoying certainly good commissions and good business, that they remember to pay their taxes to the Inland Revenue Department and ensure that they put the government in a position and the people of Nevis in a position to benefit from these considerable concessions that have been granted. Ladies and gentlemen, I shall leave that there for now and certainly take your questions.
Good morning, Mr. Premier. I'll keep my questions based to one sector. That would be what's going on with the COVID. People seem to feel the state of emergency and other restrictions don't apply to Nevis. And I see parties, people on the street after 6, and everybody seems to be wanting to do their own thing. So is the police planning to crack down on this? Also, the vaccination effort, considering that, tomorrow I think the vaccines expire, what does the government intend to do about that between now and then?
Taking the last question first, of course, we are hoping, yet again, as I'm doing now, that people rush out in their numbers to get vaccinated today and tomorrow, because you're correct, that the vaccines, the last batch we had an expiration date of the 30th of June. We are, however, making every effort to ensure that we get additional vaccines, and we would expect to have an announcement on that at the federal level fairly soon in terms of when those will arrive. But remember that the science is telling us that some vaccine is better than no vaccine at all. And even persons who have only had one shot still have a high degree of protection compared to those who have no shot at all. So what we have said is, despite the fact that, or in spite of the fact that the vaccines expire at the end of the day tomorrow, if you can get your first shot today or tomorrow, we're still urging you to do so. And then you get your second shot when the next batch of vaccines arrives, because that way you don't delay in getting some element of protection now. So the short answer is we are going to be administering vaccines until these run out, and we are hopeful that by tomorrow, end of day, that they will all be gone, because people will respond in large numbers to get their vaccine, whether to get their second dose or to get their first dose of these vaccines. Secondly, we are working on getting additional vaccines into the country so that going forward we can have vaccines available. And I won't say more on that because I will leave that for the federal authorities and the Minister of Health over there. I can say, however, that good progress has been made in relation to sourcing vaccines so that we will know that we have additional vaccines to go. I have been engaged on the diplomatic level, and so I know that good efforts have been made and there have been some results. I believe that it's a matter of public knowledge that the President Biden administration in the United States has committed to making vaccines available to the Caribbean and Latin America. And in addition to that, we have other sources that we have tapped into in order to get vaccines as well. And so at some point, an announcement will come in relation to that. But the short answer is that we're encouraging everyone to go out today and tomorrow and get vaccinated, because the vaccines are available and they should go and get them. After tomorrow, you will have to wait an announcement to determine when next vaccines will be available. So I'm hopeful that people don't wait, but they take advantage of the opportunity to go now. The state of emergency, Ms. Hewlett, thank you for that, because it goes back to what I was saying, that some in Nevis continue to be complacent. To use Nevis vernacular, some don't care. They don't care. That's the attitude that they have. I am urging our people to care and to take heed. I'm urging them not to be like the foolish virgin in the Bible, to take care and to pay heed. You ask what the police is doing? The police, I believe, have been doing a very commendable job. I met with the police just in the last several days, and they indicated that they had already given out some 72 tickets. Indeed, and I want to say it because they have my fullest support on this, the police are now starting to arrest and lock up people who they find in breach. So where people feel that they could have their party and the police find you, the police are taking you into the police station, and you spend a little time there to consider your ways and be wise. I am not making any joke with this, and I don't want people out there to think that this administration is making any joke with this. Curfew starts at 6 p.m. After 6 p.m. you should not be out, unless you have an emergency, or you have an exemption, or you are an essential worker. Stop home. There's no need for you to be out. Nevis is not on the same restriction as St. Kitts at the moment. St. Kitts is on a 24-hour lockdown. I was in St. Kitts yesterday. During the lunch break from Parliament, I took an opportunity to drive around, and there was no movement in St. Kitts. Dog, cat, and all looked like they're on lockdown. Nothing at all was moving in St. Kitts. And that suggests to me that Kittitians are finally taking this thing serious. Up here in Nevis, we didn't see the need to lock down people's business and lock people down the same way, because, as I said, we have no cases in Nevis at this time. But Nevisians, please do not make it bad for us and for you, because if we start to get cases, we will have no choice but to lock down Nevis the same way that St. Kitts is locked down. It's just the reality. I'm not going to sugarcoat it. That is the reality. So if now you have some little freedoms that your brothers and sisters on St. Kitts do not have, do not abuse them and put the island at risk. Please do not do that, because if that happens, then all of us will suffer. The small businessman who is trying to stay afloat and who we're trying to work with to ensure he stays afloat, he will have to lock down, and everybody else will have to lock down. So the police are doing their best. They're issuing tickets and they're locking up people. They found two parties one night, one of Hamilton and one somewhere here in town. And then I'm told that they found another party happening at the Hamilton Villas, I'm told, and then another one at Craddock Road. And they've been issuing tickets, and they've been taking in people and letting them spend a little time to cool off in the cell there. And we have cells up Gingerland, and we have in Cotton Ground, and we have over at the new station in Newcastle. So I've said to them, if the cell in town run out, let some people spend a little night at the countryside. People must take this thing seriously. All right? That is the reality. I don't think there's much more I can say. 6 o'clock, stop at your yard. Yes.
Sorry, Mr. Premier. Okay, Hewlett, Department of Information again. I forgot to ask one thing. Have you had any feedback from the business community with respect to the fact that businesses have been able to remain in operation, and what impact that's had on them so far?
Well, the feedback has been overwhelmingly positive, Ms. Hewlett. I think that businesses, particularly the small businesses, are very grateful that we follow the science and the data in Nevis. And since there were no cases in Nevis and no community spread in Nevis, that they were allowed to stay open. Of course, we had to manage the process very carefully because we had some individuals on St. Kitts who were saying that since Nevis isn't locked down, they want to come over here and spend time over here instead of being locked down on St. Kitts. And we gently tried to dissuade persons from doing that. And so I think on balance, we have done fairly well. I want to commend NASPA and the leadership, Joseph Liebert and the entire team at NASPA, Mr. Brantley, who's the manager there. I think that they've done a remarkable job in working with SCASPA and their colleagues in St. Kitts, working with the police, working with the boat operators as well, because I will remind the public that the boat operators volunteered to suspend their service. They weren't mandated, they volunteered. And the only one that was running was West Agency through Lady B and MV Mark Twain. And they too were cooperating with us very closely. And so we were able to restrict to the point where even students, as I said earlier, who are Nevisian but go to CFBC are being allowed to write the exams on Nevis. And those who are in St. Kitts, living, we have asking them to stay in place in St. Kitts and to write the exams over there, consistent with what has been put in place over there for them. Incidentally, I ought to have said this, so let me do so now, to wish all of those who are writing exams all of the very best. We understand that exams are a tough time. They present great stress in young people's lives, and that stress is now 100-fold, manifold, multiplied because, of course, of the restrictions. But we have tried to do the best we can. They're being transported to centers. Rules have been put in place to keep them safe, and we're trying to limit the travel between the islands to ensure that so far the island of Nevis has been COVID-free, and we want it to remain so. So thank you for that. The business community seems quite pleased, and we have always said that we are pro-business and we'll work with them. But I issued a warning that if our people seek to do the wrong thing and COVID were to enter Nevis, we will have no choice but to lock down, just as St. Kitts is now locked down. I am praying we don't get to that, but that is in the hands of our people. Any more questions for me?
And good morning. Monique Washington, St. Kitts Nevis Observer newspaper. Just one question, basically. With this 6 p.m. curfew and the extended state of emergency, how do you think this will affect the movie industry, being that some of the movies are filmed at night?
It has had no effect because from very early we negotiated with them, since they're all vaccinated, and they were here, we negotiated very early with them an exemption from the curfew, just for purposes of doing the filming at nights when they have to. In any event, I'm advised that the last film they were working on, which is 1 Week in Paradise, that has just wrapped. That is completed. And I'm told that most of them are going back to the UK, where some of that film is being done. So the filming that was being done on Nevis for that film is complete. And there's some filming now for the same film, I'm told, that is to be done in the UK. And so the producers and everybody are going there for that. So I suspect that by the time they get back, I'm hopeful that we'll be past this period of lockdown and curfew. If the numbers fall in St. Kitts, we saw 0, we saw 1. Yesterday, unfortunately, we went back up to 10. But if the numbers fall in St. Kitts, as we expect them to do over the next 14 days, and Nevis continues to have 0 cases, we could anticipate that the curfew will be lifted or adjusted, as the case may be. And certainly the lockdown could also be adjusted or lifted, as the case may be. The purpose of the state of emergency was simply to give us the leeway, the mechanism to put what we need to put in place, so that we don't need to have to keep going back to the Parliament every time in order to make this happen. Bear in mind that under our Constitution, the government can announce a state of emergency through the Governor General, of course. The Governor General announces a state of emergency under his powers, but only for 21 days. So once you're going to go beyond 21 days, Parliament now needs to do so. And Parliament needs to do so by a 2/3 vote in Parliament. So it's a serious matter. It means that it requires consensus. And that is why we were in the Parliament yesterday. And we would have voted on it. A poll was done. And all of the government side voted. The opposition, regrettably, 1 abstained and the other 2 left. So they didn't record a vote. but the government side unanimously voted in favor, which extended the state of emergency until December. I would also make the point that was made in the Parliament yesterday that other countries around us, in fact most, are still under a state of emergency. Grenada, Barbados, I believe Antigua and Barbuda, they're still operating under a state of emergency. So the state of emergency really ought not to cause any alarm. It is merely designed to give us the mechanism legally where we can put the necessary statutory rules and orders in place and ensure that things like a curfew, if necessary, lockdown, if necessary, can be done without there being any violation of the law.
Good morning, Devon Cornelius, WinFM. Can you provide an update on the One and Only Resort? Can you also provide an update on works happening at the hospital? And lastly, how many people have been contacted for, remain in, and released from quarantine in Nevis as a result of contact tracing?
You're talking contact tracing since the last case?
Since May 19th. Yeah.
Since May 19th, okay. I don't have that number, unfortunately. I really don't. I'm sorry. I didn't anticipate that question. I can tell you that from the case that we registered, case number 15 on Nevis, that we would have tested over 60 individuals on that case. I'm sorry, from that case. And that after the CMO would have announced, the chief medical officer, that if you were fully vaxxed, you didn't have to be quarantined. Then obviously some of those persons who that case came into contact with were fully vaccinated. They were still tested, but they weren't quarantined. And so those individuals would not have been quarantined. The others were largely home quarantine, were asked to home quarantine. And they would have now done 2 tests. One at the point when they were identified and one 14 days later. All of those individuals have, as of yesterday, had their second test and all are clear, no COVID. And the one, case number 15, has recovered fully. So I regret I don't have a precise number for you since May 19th, but the number as of case 15 is just about 60 or thereabouts, I'm advised. The hospital project, I think that the hospital project is proceeding apace. We have suspended the construction activity. Not that the project has stopped, but I think I reported on the last occasion that we'd engaged some consultants to deal with the internal configuration at the hospital. So those consultants have been here. We've suspended the hard construction because basically that external construction, the roof, the building itself is complete. It is now only for the interior to be done. So what we're going to do is, with the help of these consultants, get the interior configured in the best way for purposes of that hospital, and then we will resume with the actual construction on the inside of the building to take it to completion. I would want to Minister Hazel Brandy Williams and her team, PS Shalisa Martin, who have been working really hard with the consultants to get this done, and with our local engineers as well. So I would anticipate that work there should resume very shortly. One and Only Resort, it's interesting you asked about that because I believe I'm scheduled to have a conference, a video conference call with the developers this week to do the very thing that you're asking me, to get an update as to where we are. You would recall that we had made an announcement when we signed some agreements with the developer, and that required that the developer had certain dates that they had to meet. We are now going to have a meeting with them to determine where they are in relation to those dates, to secure the financing, and of course to commence construction. So that's what I will be doing this week. So I don't have an update for you today because I myself will get an update later this week when I speak to them. Any other questions? Yes?
Good morning to all.
Morning.
Shamika Bajin, Von Radio. Thank you so much, Premier, for giving us a well-detailed report